So the initiatives is, the first initiative will then be to increase awareness. So we need to adopt patient education. Patient education is important. We can do that on individual basis, telling them about symptoms of the disease, the possible complications, and the possible outcomes. Then we need to use social media, all aspects of mass media, to promote the concept of early detection. And so if we do that, that will increase our awareness. And then there are some cultural values. For instance, doing digital rectal examination. Some people find it very strange. And so we need to educate them that this is a harmless procedure, just sticking your finger. And so those are some of the initial measures that are targeted at the masses. Now, we also know that screening of the population is important. Now, we know that screening is controversial. Some researchers have found out that, okay, when you screen, you even get some diagnoses that are not clinically relevant. And so there is the problem of over-detection. That's on the other side. But it's also known that those people who have stopped screening, they are now seeing prostate cancer coming at a later stage, being diagnosed. Now, but for African Americans, there are studies, and then the Black people in Africa, we know that because they tend to, the disease tend to be at higher risk because of the age of presentation. And there are studies that have shown that screening is beneficial to Africans, to Blacks, more than the white. So one of the things we want to do is to advocate screening. Now, but we know that we don't have all the resources. And we know the problems of the limitations of massive screening, population-based screening. So we are advocating screening the population at risk. And so we involve shared decision-making, telling the patients, and now if your father or your first-degree relative have had prostate cancer, the chances of having prostate cancer will be the risk more than 2.5, and so such people should be targeted. Then if you have something cancers in your family, you will be targeted, okay, like breast cancer. If you have done some genetic tests and they show that there are some mutations or alterations in your system, you will also be a candidate for such targeted screening. And so then we also look at using the age of the patient. Now, the age is important because prostate cancer is a disease of aging. Okay, we know globally. Now, the age at which you screen matters. In some studies, they have advocated 40, 50 years, 45 years. But in Africans, because of the higher risk and the relatively shorter period of presentation at the age of first diagnosis, we are advocating, the motivation we are advocating is that we can use 14 years as the age for initial screening in Africa. And then that is for the Black generally. But we also know that if you already have a family history, then 40 years they are advocated. If you also have any of the mutations in your system, 40 years is advocated. Otherwise, we use 45 years, which is more universal for the screening. Now, we also know that you compare life expectancy, and so we will not just screen forever. So for now, there's no study among Africans to show the stage at which you must stop screening. So, but we will advocate using the universally accepted 75 years or thereabout. That is the stage at which you don't have to screen everything. So screening of the population is important. Then we know also that to screen, apart from those risk factors I've mentioned, we will use physical examination, digital rectal examination, as one of the things that you check before you screen a patient. So if you have an abnormal digital rectal examination, we'll consider it. We're also going to consider PSA. There are various variants of PSA velocity, PSA density, PSA percentage-free PSA, and all that. So we will use PSA, but we're not going to use digital rectal examination alone. We're not going to use the risk factors alone. We're also going to combine it with PSA, digital rectal examination, and all those other things. Sometimes we may consider use of biomarkers and also genetic tests, all to see whether there is need for us to have this shared decision making concerning screening. So screening is one of the measures we want to adopt